So Wendy Williams recently had an interview with Fat Joe on Instagram Live, and it also aired on YouTube. And I'm gonna tell you, that interview had me concerned, and it had me somewhat heartbroken, and really my heart going out to Wendy, because clearly there are some concerns there cognitively, and those concerns that I have regarding her cognitive state does provide some justification to some of the rumors that were out there regarding her having dementia. And this is why I say that. I'm not saying that she has dementia, but what I am saying is that there is reason for concern. Hi there, Doc Squad. Dr. Macie Smith here, your social gerontologist providing education, training, and caregiver coaching to help you and your families reach the next best level of care. So in Wendy's recent interview with Fat Joe, and I have the link below so that way you can check it out when you have time. The reason why my heart got real heavy when I saw that interview with Wendy, because within the first 5 minutes, I could see that she had concerns with communication. She was having trouble with communicating her thoughts and choosing the right words. So I'll tell you that, as I stated in a previous video, dementia is not a disease. It is not a diagnosis. It is the symptoms of a diagnosis. For example, if you have a headache, and you go to the doctor for a headache, the headache is the symptom of, could be a brain bleed, it could be an infection. So what's causing that headache is the actual disease. So with someone having dementia, something has to cause dementia. And I'll put a link to that video below so that way you can check it out as well. But when really listening to Wendy's interview with Fat Joe, I immediately noticed that she was having trouble finding the right words to fit what she really wanted to say. Some of the early signs and symptoms of dementia as it relates to communication is difficulty tracking conversation, word find difficulty, difficulty concentrating, repeating familiar words, and hiding what you can't remember. So Wendy displayed all of these in the interview with Fat Joe. But let me say this, although these may be early signs of dementia, these are also early signs of PPA, primary progressive aphasia. I'll include a link below to an interview I did with professionals who work in the aphasia arena. And it was very, very fascinating. But it didn't appear as if she had problems with short-term memory. And again, I'm basing this on listening to Wendy when she came on air here in South Carolina almost 20 years ago and comparing it to now. And so as I go through this talk, I'm going to share with you what I would share with Wendy and her family if they were sitting right here in my office. In that interview, she paused a lot. She used a lot of vocal fillers. You know what I'm talking about. She also hid what she couldn't remember, because she would say, we'll talk about that later, or I don't want to talk about that now. Her communication, or her track of communication, was not always cohesive and comprehensive. She kind of went off in different directions as Fat Joe was asking her questions. She started talking about Joan Rivers and some of the items she got from Joan Rivers when she would visit her. She even went into talking about a jersey she got from Biggie Smalls before he died. And there was a point in the video where she was holding up the tag And as opposed to her saying that she didn't remove the tag, she said something totally different. She uses simple words, very elementary words. There was a point where she was talking about things happening to people who are well off or wealthy, but she didn't use the word wealthy or well off. She used simpler words such as someone who has a lot of money, because maybe she could not think of the word at the time that she wanted to use to relay her thought. She used a lot of body language and hand gestures. That's just like anybody else. If we're trying to figure out the word that we want to use to relay a particular topic, we might do our hands like this, or look up or look down, or just kind of fidget because we're trying to find that word. We're trying to figure out how to cohesively and comprehensively relay our thoughts. So again, those are typical signs in the early stages that we tend to see with someone who may have dementia. But again, these are signs and symptoms of someone who may have aphasia, primary progressive aphasia. But again, these are all symptoms. Something has to cause it. Some causes of dementia, it could be substance abuse. It could be medication interaction. It could be chronic illnesses or other medical illnesses co-occurring at the same time. That's clouding a person's psyche. It's clouding their ability to exchange information from one neuron to the next. It could be high blood pressure. It could be diabetes. It could be thyroid concerns. Dementia can be short-term because it's caused by something that's treatable, or it could be caused by a progressive condition or progressive illness. Now, Alzheimer's disease is the #1 type of dementia, and that's why you hear the conversation about Alzheimer's and dementia. Actually, Fat Joe did ask her straight up, did she have Alzheimer's disease? And she did not answer that question. She started talking about her money and how Wells Fargo is taking her money. And I understand that connection because that may be what's being considered a factor in freezing her assets. And so to my doc squad, many of you have asked, what are some of the early signs of dementia? What does it look like? It looks different on different people. However, if communication is a challenge for someone you care about or love, or if it's something you're concerned about, you definitely want to seek the attention of your primary care physician. If Wendy was sitting in my office right now and her family, this is what I would recommend immediately. I would have her make an appointment to her primary care physician, so that way that primary care physician can refer her to a neurologist in order to do brain scans to figure out where the disconnect is, what could be potentially causing that cloudiness or that disconnect. She could have had a stroke. It could be caused by stroke activity. Some people have mini strokes, several mini strokes causing vascular lesions to the brain, and people don't even know. Sometimes they don't even know. So that neurologist will do brain scans and will make a determination if they see anything of concern: brain bleeds, stroke activity, hematoma, atrophy. And that's where they can see where parts of the brain have dissipated. That neurologist will also do a cognitive assessment or a cognitive test to determine whether or not this person's cognitive ability has decreased from another particular point in time in their life. That neurologist will help establish baseline to determine what significant changes have occurred and to figure out what could be potentially causing these changes. You can't fix something when you don't know what's causing it. And so that's what I would recommend. And then I would recommend that they reach out to the AFTD, which is the Association for Frontotemporal Disorders. Because in your frontal lobe and your temporal lobe, that's where language is formed. That's where your memories are formed. That's where your speech is. And so it's going to take a team of professionals to figure out what is happening, but there is definitely something happening. Not saying it's dementia, not saying it's Alzheimer's, not saying it's anything progressive, but it is something medical happening that's interfering with her ability to communicate her needs, thoughts, desires cohesively and comprehensively as she once did. For these videos and more, be sure to like, subscribe, and click the bell so that way you know when I upload a new video. Until next time.